Hello, my name is Dr. Horatio Capote, and I'm the director of the Division of Neuropsychiatry at Dent Neurologic Institute. I'm very happy to be sharing this time with you today to talk to you about a very important topic. This is Mental Health Awareness and Suicide Prevention Month. And I myself, as I reviewed the data, was astounded to realize that 1 million people a year die as a result of suicide. Uh, Comparatively speaking, there are many other diseases that we expend a lot more effort and, frankly, a lot more finances to prevent than something as all encompassing as this. Um, there are a lot of myths to discuss and a lot of questions that you may have. So hopefully we'll be able to cover a lot of these. Certainly one of the big ones is that you can actually make people suicidal by bringing up the topic. That is completely false. In fact, many people are just eager to be able to discuss it, share it, and have an outlet. So if you have a suspicion, it doesn't hurt to ask. And if somebody says, no, that's not a problem for me, then great. But you're not going to do anybody any harm by asking, bringing up the topic. And actually, it really shows that you're empathic and that you care. Um, there are lots of other myths to discuss. For instance, the thought that people that are going to do it, there's nothing that you can do to stop them. In fact, the data shows us that everyone is extremely conflicted about suicide all the way to the end. So there are many places to intervene and many things that can be done. But the first thing is to have a curiosity, to reach out, and to be willing to be part of the solution. Um, there are lots of warning signs that you can note when someone suddenly seems to be obsessed about death, thinking about death, writing about death, uh, talking about it. That may be a sign. When younger people suddenly have what looks like a change in personality, changes in their behaviors. These are signs that something is going on that's worth identifying. There are more major signs of trouble. For instance, a positive family history. If there are biological relatives that have actually committed suicide, there certainly seems to be some genetic components there. And so that would be something to keep in mind. If that individual has attempted suicide before, that's a great concern. Um, and of course, the presence of identified mental illnesses, such as different forms of depression. There's regular unipolar depression, there's bipolar depression. It doesn't matter, it's all a concern, but actually, people with schizophrenia and many other mental illnesses have a much higher risk for suicidality compared to the general population. Um, One of the things that is important to note is that treatment actually works. Sorry about that. So um, there are times that we tend to get a little bit pessimistic about treatment, that we say to ourselves, Wow, these conditions are so difficult to treat. We have, for instance, some very good data-driven information from the STAR-D trial. It's a trial on depression that shows fairly low rates of response to antidepressant therapy. And so we ask ourselves if this is a pretty common disease state, which we've been battling with for many years. How is it that we have such poor results? It's important to note that there are many, many different treatments, not just pills. There's actually procedures, there's psychotherapy, there's lifestyle management. It all works. One of the comparisons that I like to make is with diabetes. Is there the person with diabetes that takes their insulin and they're more or less okay? Sure. But the individual that learns about nutrition, engages in exercise, knows their medication, maybe even does yoga and Tai Chi, maybe even expands their spirituality, boy, that individual thrives. And so it's very much the same with mental illness. There are medications, but that's just part of the picture. There's psychotherapy. There are many forms of psychotherapy, and some of them are better for different things. There's cognitive behavioral therapy, which is very good for anxiety and depression. There's dialectical behavior therapy for people who may have difficulty managing their relationships or understanding their own emotions. There's psychodynamic psychotherapy, supportive psychotherapy. It all helps. There's the importance of exercise, right? People that are active and feel sort of engaged and feel a sense of agency in their lives. They're empowered. They do well. That's very good. I think everyone agrees that the Mediterranean diet is pretty good for the brain. So the Mediterranean diet is probably just a fancy way of saying colorful foods. If it's colorful, if it's not bleached and processed, it's got, lots of antioxidants that are helpful and protective to your brain. That's an important factor. Now, again, medication can help, but in those cases where medication ceases helping, we have a variety of treatments, and we have, fortunately, all of them available here at Dent Neurologic Institute. To my knowledge, perhaps one of the few places that may have all of these things co-located in one place. So we have electroconvulsive therapy. In fact, the only freestanding outpatient electroconvulsive therapy program in the country is here at Dent Neurologic Institute. I was there 6:30 a.m. this morning working in that program. It's changed quite a bit. There's a lot of bad stigma and unusual ideas from old movies that really do not apply. It is one of the most effective treatments in medicine. The efficacy rate is something like 80%, which is extremely unusual. So that's very good. We have transcranial magnetic stimulation. So in this case, instead of the patient undergoing anesthesia and having electrical current applied, with transcranial magnetic stimulation, the patient is wide awake, and magnetic waves are used to stimulate the brain. One of the benefits of that is that the patient can drive themselves back and forth from treatments. Since they don't undergo anesthesia, there's no need for someone to drive them back. So it could be a lot more feasible and easy for the individual to schedule that type of treatment. Um, there are other treatments that have arisen over the past several months as well. One of them is the use of intranasal esketamine. So that is a treatment for someone with treatment-resistant depression that is on an antidepressant. It's not working effectively enough, and this other treatment is added to it. It requires that the individual be watched for a couple of hours after treatment, and they can't. The medication is sort of similar to an anesthetic, so they couldn't drive back on their own. But again, a tremendous advancement in the field, and some patients notice a difference almost instantaneously. So that's another exciting thing. We have probably about 36 patients with vagal nerve stimulators. So this is a little pacemaker which stimulates the brain through the vagus nerve. It looks just like a pacemaker. It gets implanted right here, and the wire goes up on this left side here and sends up signals to the brain. About 30 seconds of stimulation every 5 minutes is the average. So again, it's like a little pacemaker for the brain, highly effective, requires surgical intervention. So it's not something that we go into lightly. But again, it offers hope to people for whom the usual treatments have ceased to function. Or we can combine these different treatments for maximum efficacy, say medication plus vagal nerve stimulation. Um, Vagal nerve stimulation, interestingly, is not limited to any one diagnosis. Some treatments are more specifically for unipolar depression, but vagal nerve stimulation can be used even for bipolar depression, all across the board. So that's kind of a benefit as well. Sometimes we get caught up with the actual indication for the treatment. There are a couple of patients that we've treated with deep brain stimulation. So that's actually a little bit more invasive in that the electrodes are actually placed right inside the brain. That has a formal indication for treatment-resistant obsessive compulsive disorder. But quite often these people also suffer from depression as well. That wouldn't be surprising because the condition of OCD usually stipulates a great deficit of serotonin. And in general, OCD is considered an anxiety disorder, and oftentimes the anxiety disorders go hand in hand with the depressive disorders. And so these are very interesting patients, very challenging conditions, but deep brain stimulation is a possible option for any small group of people. But again, it offers hope. It offers solutions, and frankly, we're willing to explore all of those with all of our patients. I try to be modest whenever I can, but one of the things I pride myself in telling people is that I'm hard-headed and I don't give up. So we try to look at all of these different treatment protocols and different treatment solutions for our patients. There's a new treatment modality available for postpartum depression. And that is an exciting new thing. It's different in that it's a medication, but essentially a one-time 72-hour situation not a daily ongoing medication forever. So one can envision a new mother with concerns about things like breastfeeding and are these meds going to get transmitted to the milk and all these questions. This is an option that may be very, very intriguing for them as it's a one-time concerted effort. Um, and we're certainly involved and interested in that as well. There's an off-label treatment that has been gaining popularity actually for several years, and that's intravenous ketamine. This was actually first studied at the National Institutes of Mental Health. There, one of the great protagonists was Dr. Carlos Zarate, a great physician, and they have shown amazing results. Almost immediate cessation of suicidality, prevention of hospitalization, some very interesting outcomes from their studies as well. And so that is another option. That story actually has evolved as well because at first it was used as sort of one-time treatments, and then now there's more move to make it sort of an ongoing maintenance kind of treatment. If you will forgive me for a second, I'm getting old and blind. I'm going to put this on and look at my little screen real quick and look at some of the questions that y'all are asking. Okay, so the first question is, I have a friend that is showing signs that they seem to be crying out for help or attention. What can I do? So the first thing that you can do is just frankly talk to that individual, be honest with them, say, look, I care about you. I can't know what's in your head, but I suspect that something is going on. And you could give them the reasons, because I notice that you're more withdrawn. I notice that it looks like your sleep patterns are off. You're showing up late to things and you used to be quite punctual. Whatever the example is, you reach out to them and you say, what's going on? Are you thinking about harming yourself? Are you feeling hopeless? That turns out to be a major factor. When people feel hopeless and helpless, and they can't come up with solutions, that's when drastic solutions become something that they consider. So definitely open up the communication lines, reach out, ask the question. You're not going to make them suicidal. And you may, as quite often when I do this, see the person have a sigh of relief and be glad to open up and be able to share and begin the conversation. And then from there, you can look at, recommending that they reach out to different providers, or you can certainly reach out to us here at Dent Neurologic Institute, and we'll do everything possible to be helpful. All right. Let me look at question number 2. Yes. The question, it seems that SSRIs don't work and may actually contribute to suicidal thoughts. Any studies done regarding the use of medical marijuana? So, wow, we could talk for a long time about this. Number one, the antidepressants in general, whether they be SSRIs or SNRIs, certainly can be misapplied. Sometimes the question is getting the right diagnosis. If the person's actually bipolar, but nobody's going to present in the stage of euphoria, right? That at that point, people are feeling okay and they're not going to go to the office. So they're going to present to you in a state of depression. We don't get the data, or that data is obscured from us, and inadvertently diagnose the person as having a regular unipolar depression when in fact they may be bipolar. That's one way that antidepressants can cause trouble for people. Um, and so that's one of the issues there. To my knowledge, there's certainly a great interest in medical marijuana and mental health. There is an indication, at least in New York State, for post-traumatic stress disorder. I'm not a medical marijuana provider, so certainly don't take me to be an expert on medical marijuana. My overall instinct from we have a very active, very passionate medical marijuana clinic here at Dent Neurologic Institute, and my overall instinct is that when you compare the percentages of THC to CBD, it seems like the CBD component is helpful with anxiety and insomnia, and perhaps it's a question of the percentages of each. Perhaps low THC, high CBD may be quite useful. That at least is my gut instinct. Again, I don't purport to be an expert, so that's sort of a general impression. Absolutely, the old line about more research needs to be done, I think holds very true. I think definitely the only way to address all of these issues is with data, more information, more research, and more knowledge, right? The truth will set us free. I don't know who said that, but I think it was true. All right, it looks like there's more questions.
What was the last one?
Oh, okay.
Just thank everyone for watching.
I'd like to thank you for this opportunity to share this time with you. Again, we're here open to be helpful any way that we can. We're very proud of all of the things that we do here at Dent Neurologic Institute, but we're very also happy to be an active and important part of the community, to be engaged in the community. So we look forward to you letting us know what the problems are, what the issues are, and letting us know how we can help. We're always glad to do that. Again, thanks again. Have a wonderful day. Thank you for tuning in, and I hope that you good health and good spirits. Goodbye.